Hello students, today we are going to talk about COVID-19 and how you can stop the spread. Presented to you by Native Challenge. So Native Challenge is a department with Riverside San Bernardino County Indian Health. We teach Native students in the Riverside and San Bernardino County area at schools such as Noe Indian School, Sherman Indian School, Banning High School, Nicollet Middle School, San Jacinto High School, as well as North Mountain Middle School. So we teach the Native youth between 12 and 19 years old, and we are considered health educators with Riverside, San Bernardino County Indian Health. So today we're going to talk about what is COVID-19. So COVID-19 is an illness caused by a new type of coronavirus. So the CO stands for corona, the VI stands for virus, and the D stands for disease. The number 19 is for the year that COVID-19 or coronavirus started, 2019. So how does COVID-19 spread? So first, mainly from person to person between people who are in close contact, so within 6 feet apart. So how far is 6 feet apart? So maybe one of your taller uncles, maybe one of your taller siblings, maybe your dad or your grandpa who is 6 feet tall, but a very, very tall person. Or you can think of it as a basketball player, somebody who is about 6 feet tall. So this occurs by respiratory droplets produced when the infected person coughs or sneezes. So when you come into close contact, breathe, coughing contact, droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. So that's why it's important to stay 6 feet apart from each other. Another way to stop the spread of COVID-19 is wear your mask, students, whether it be your homemade mask, whether it be the mask that you get from the doctor or that cool mask you ordered on Amazon, but wear your mask. So I'm going to show you a quick video from the Gurney Room on Instagram on how these droplets and how COVID-19 is contracted. So as sprays, they cough, and how that mask protects from going inside either the nose or the mouth. You see the droplets on the mask. So we're going to test it again with the mask on. Because if 2 people have masks on, there's no droplets, obviously, on the other person. And the droplets stay within your mask or kind of go down onto your clothing. So as you see, wear your mask is very important when trying to slow the spread of COVID-19. So wearing your mask protects our elders and our vulnerable. So be responsible, students. Wearing a protective face mask helps lower the transmission of COVID-19 and helps protect those who are most at risk from contracting it. So like I said, those are our elders, our grandpas, our grandmas, the people who we look up to. So sometimes they have other medical conditions that are hard for them as it is right now, and contracting COVID-19 can make it even harder for them. So we want to wear a mask and protect our elders and those who we love and care about the most. So how serious is COVID-19? Well, it must be pretty serious, right, students? If we see it all the time on the news, we hear it from the governor of California, we hear it from our president. How serious is COVID-19? So in our state of California, as of September 15th, 2020, we have reported that confirmed new cases in California is 760,013 cases. Out of those cases, 14,451 have died from COVID-19. So as you see on the bottom part of this graph, the new confirmed deaths in California by date, as you can see, it started slowly and kind of steadily growing from April to June. And in June, we started to see that spike during the summertime. People were starting to gather around more. They were tired of staying home, wanted to be around friends, families, whoever that may be. And we started to see an increase in cases in August. And now we're kind of slowly seeing it decrease as our months go by. So what are the symptoms of COVID-19? So we can have a sore throat, we can have a headache, we can have a cough, we can have weakness, we just want to lay down. We can have fever, whether it be the chills, we're really, really cold, or we're really, really hot, and rhinitis. So the kind of the pressure on your nose, kind of like a sinus infection. All these are symptoms associated with severe respiratory illness, which can cause trouble breathing, constant pain or pressure in our chest, new confusion, things that just kind of don't feel right, and bluish lips or face. So you do not have to have all of these symptoms. You can have one symptom, you can have two symptoms, or you can have multiple symptoms. So as the months have gone by and the new research of COVID, there has been additional symptoms too as well, such as diarrhea, loss of taste or smell are some of the newer symptoms of COVID-19. Or you can be asymptomatic, which means no symptoms at all, and you kind of carrying that COVID-19 and spreading it, not even knowing it. So you can have no symptoms at all too as well and still contract and spread. So who is at higher risk? So we talked about in the previous slide that our elders are at higher risk. So those older adults, 65 and over. We have our smokers who are at high risk. The individuals who have serious chronic medical conditions like asthma, high blood pressure, heart conditions, and individuals with compromised immune systems. Diabetes, which usually are elders, or even maybe some of the people that we love and care about who have these underlying conditions. So low risk isn't no risk. So even if you are less than 60 years old, somebody like yourself, and do not have an underlying health condition, you can still become sick with COVID-19. So this is according to the World Health Organization, to clean your hands often. Remember, washing your hands for 20 seconds, saying that happy birthday song 2 times, coughing or sneezing in your bent elbow and not in your hands, because sometimes when we sneeze in our hands, we tend to touch things right after if we do not have the availability to wash or even sanitize. You want to avoid touching your eyes, your nose, and your mouth, because touching those things after touching other surfaces such as a doorknob, maybe a handrail, and we do not know who's touched those things previously. You want to limit your social gatherings and time spent in crowded places. So big parties, we don't want to go to Disneyland. Obviously, it's closed. It may be a crowded beach where there's a lot of people around and they're not maintaining that 6 feet social distancing. You want to avoid close contact with somebody who's sick. So you don't, as much as you would love to go over there and take care of your granny or your auntie or your uncle or your cousin, you want to avoid being around anybody who is sick at this time. And last but not least, clean and disinfect frequently touched objects and surfaces. So you want to clean those door handles. You want to clean that cell phone that you sometimes leave on the counter when you're buying something at the fast food restaurant or wherever that may be. But you want to constantly clean and disinfect. If you're able to get Lysol wipes, Clorox wipes, be sure to use them often. So say we don't have that available sink and hand soap to wash our hands for that happy birthday song twice. Our second alternative would be hand sanitizer. So hand sanitizer should only be utilized, like I said, when that soap and clean water are not available. Hand sanitizer becomes ineffective after 5 times of use. So if you can constantly use that hand sanitizer, after a while, it's not going to work, students. A final concentration of 80% ethanol or 75% isopropyl alcohol is recommended. So some hand sanitizers don't contain these concentrations, and if they don't, it is not going to be as effective. Ethanol exposure can result in nausea, vomiting, headache, blurred vision, permanent blindness, seizures, comas, permanent damage to the nervous system, or even death. So you want to make sure that your hand sanitizer is not expired, that your hand sanitizer contains these specific concentrations, because the repercussions of it being bad could cause even death. So some frequently asked questions, students. I'm bored staying home since I'm very unlikely to get severely ill, even if I was to get COVID-19. Why is it important that I follow the guidelines to prevent transmission, such as keeping physical distance from other people? Well, let me tell you why. You might be one of the unlucky adolescents who does get severely ill if you catch COVID-19, or you could spread it to others and be responsible for them getting really ill or even dying. You have the power to make choices and save lives. Another frequently asked questions. Some of my friends are not sticking to the rules about physical distancing. What should I do? So do you become that follower or do you become that leader? So explain to your friends why it is important to protect themselves and others. Maybe you could share ideas for fun virtual activities like that cool new Xbox game, Xbox Live, or that PlayStation 4 that you and your friends can participate in. Or maybe you get into a cool Kahoot game that you create online. This way you are giving alternatives rather than just telling them to stay home. So we all want to kind of keep busy during these times. So some young Americans are partying hard and spreading COVID-19 quickly was a headline in July. COVID-19, the teen party that became a virus outbreak. Wow. 20 teens in New Jersey test positive for coronavirus after a house party. Uh-oh. Teens contract coronavirus after partying at a Delaware beach. And about 300 teens exposed to COVID-19 at a big party near Austin. Students, these are real news articles in June and July, when the height of COVID-19 was almost skyrocketing. It was at its peak, and teens decided to still go out and party, to still go to the beach. So we need to be very mindful about where we're going and what we're doing, and like I said, stopping the spread. California COVID-19 crisis being fueled by racist parties, young adults. Influencer reportedly hospitalized with coronavirus after licking a toilet. So that influencer should not be that good influencer for us students. We do not want to be licking toilets. Violet Benson posted, "Glad I have to be stuck at home because of people like you are taking COVID more seriously." I think Violet's being a little sarcastic there. And warning, a lot of influencers have been confirmed to me testing positive for COVID-19. after the influencers parties with an S, students, like a lot. And they aren't saying anything and aren't warning people they came in contact with after. If you attended, get tested, you're all an outbreak. You all caused an outbreak. Thanks. So, that's not very good if they are contracting COVID-19 and not saying anything about it, because you're going about your day, your lives, without knowing that you have COVID. Like I said, you can be asymptomatic and walk around with no symptoms at all. So instead of going to those crazy parties or going to the beach where there's hundreds of people there, here are some quarantine activities that you can do at your home. So social distancing, I'll be there for you from 6 feet away. Read a book, cuddle your pet, FaceTime friends and loved ones. Bake some cookies, but not too many. If you do bake too many cookies, be sure to exercise. Maybe you get creative. You start taking up painting or beading or some kind of craft making. Go outside for a walk, rest and recover. These times is times for us to catch up on our sleep. Gardening, see what flowers are blooming at this time of year. See, maybe planting a fruit tree to keep your bodies healthy. Maybe you sit down and meditate. Find a cool YouTube channel to help meditate with. And clean your house. Maybe it's time to organize or reorganize. Out with the old, in with the new. So here are some COVID-19 resources for you. We have the CDC, Center for Disease Control and Prevention, which gives you up-to-date COVID-19 information. We have the San Bernardino County. We have the California Tribal Epidemiology Center, California Rural Indian Health Boards, University Health Systems, the WHO, World Health Organization, and the California Department of Public Health. So if you want to look into any of these resources for up-to-date COVID-19, go ahead and check these out, students. Questions? I'm sure you have lots of questions, right? And if I was there with you, I'd be happy to answer them to the best of my ability. But if you do have questions, students, more than welcome. You are more than welcome to reach us at ccg@rsbcihi.org or at 951-849-4761. Or you can follow us on social media at Native Challenge. So us at Native Challenge, we have an Instagram, we have a Snapchat, we have Twitter, and we have Facebook. So remember, at Native Challenge, contact us with any questions that you may have, or feel free to email CCG or give us a call at the number right there. Wanted to thank Valentina, our health educator, for creating this awesome PowerPoint for your information. And remember, to help slow the spread of COVID-19, wear your mask, stay 6 feet away, stay home, stay active at your home, and always remember to wash your hands. 20 seconds, happy birthday song 2 times. Thank you for listening to me, Geneva Mojado, your moderator. I hope you have a great day and stay safe, students.